Hi, and welcome to the last in our Conceive Baby webinar series for 2016, and on one of my favourite topics. Anyone who receives my regular emails will know that my motto is being the best mum starts well before birth. And in fact, I'm probably being gender biased there. Being the best parent starts well before birth, well before you even have your child, before you even conceive, before you're even pregnant. You are already carrying all the genetic material that has the potential to become your future child. So the nourishing and the nurturing really starts now. And research shows that the environment in which your egg and sperm develop prior to conception has a significant impact on not only, of course, your chances of conceiving, but also the long-term health of your future baby. So for anyone who hasn't joined us for the previous webinars, my name's Tasha Jennings, founder of Conceive Baby. I'm a naturopath, nutritionist, natural fertility specialist and author. I've written and provided expert comment for various media publications such as the Herald Sun, The Age, New Idea, Mouth of Mums, the Bub Hub, and other parenting and pregnancy magazines and websites. And my first book, The Vitamins Guide, was published in 2013. And that's sold throughout Australia, the US, the UK, Canada, Amazon, and of course, the Conceive Baby website shop. And my second book, The Fertility Diet, really epitomises where my passion lies. That was just published last year. And really for the past 5, going on 6 years now, I've specialised in fertility and pregnancy. And my reason for specialising in this area, I guess, was quite a personal one, really. I was wanting to conceive and was having difficulty. So what started out as a small personal project to help me fall pregnant really became a career passion as I met with specialists both here and internationally, and was really inspired by what I was discovering in relation to the role of certain nutrients on fertility and the long-term health of the developing baby as well. And this is how my company Zycia was born. And Zycia means life and specialises in premium pregnancy nutrition from conception all the way through to pregnancy and breastfeeding, including the prenatal supplement Zycia Natal Nutrients. And more recently, to further support couples on their journey to pregnancy, I launched the Conceive Baby website, which is what you all see today. And again, this was based on my own fertility experience, or probably more likely the lack thereof. But I was lucky enough, I guess, to have a background in health and nutrition. And with my husband being a cardiologist, we were fortunate enough to, I guess, to have the knowledge and the medical context that meant that our fertility journey was relatively short compared to many couples that I do speak with. And we're now blessed with 2 beautiful children, photos of whom you will see scattered across the Conceive Baby website, including the prominent photo of my son Jonah that I do get asked about. And my aim for Conceive Baby was really to bring together a team of specialists across all aspects of fertility and preconception health, so that other people who were struggling, like we were, could have access to the type of qualified expert information that we were fortunate enough to have. And a valued member of that expert team is Dr Joseph Sgroi. Now, Joseph is an obstetrician and gynaecologist at the Epworth Freemasons, providing care to patients in the areas of obstetrics, gynaecology, polycystic ovarian syndrome, endometriosis, fertility preservation, and IVF. His interest in the field was sparked by the birth of his first child during his medical training, and he has since received a diploma in obstetrics and gynaecology, completed his formal training at the Royal Women's, as well as a fellowship in reproductive endocrinology and fertility preservation. Now, Joseph's also served as a director of the Australian Medical Association and a medical representative on multiple Commonwealth government advisory committees. In addition, he sought to improve the education and training of our junior doctors as chair of the Federal AMA Council for Doctors in Training, and was appointed to the Royal Australian and New Zealand College of Obstetricians and Gynaecologists Training and Assessment Committee, as well as being their media spokesperson. Now, Joseph continues to mentor future generations of doctors in his role as consultant obstetrician and gynaecologist at the Royal Women's Hospital the Melbourne University of Melbourne. And Joseph is continually updating his knowledge with evidence-based medical research that improves outcomes for his patients, including his strong interest in preconception health, which we are lucky enough to have him talking about today. So welcome, Joe.
G'day, welcome, and thank you so much for taking the time. I'll just make sure that everyone can see me and everything's fine.
Everything's looking good this end. Yeah, I know you've got some slides to share with us. So
most definitely. I'd like to echo what Tasha sort of said, and that is so much that in actual fact, what we do preconceptionally prior to even contemplating pregnancy and how we live our lives prior to actually becoming pregnant is ultimately going to have a major impact on not only pregnancy outcomes, but the health and well-being of our future children. And so part of today's presentation will focus predominantly on what are the sort of key elements to think about prior to conceiving and becoming pregnant. So we're going to have a look at some of the presentation, and of course, if anyone's got any questions they want to ask of me during that period of time, they can certainly do so as well. So we'll just bring that up now as we speak, with technical difficulties as they might always prevail when time happens.
I always let people know we're much better at creating babies than we are at technical things. So be patient with us. I think you'd rather us specialise in that.
Exactly. All right, let's have a look and see. And of course, it's not coming up as it was before. All right, bear with me 2 seconds.
We did have a great practice run, didn't we? It's always the way.
All right, here we go. Magnificent. Okay. So I'll just make sure you guys can see that at your end.
It's just coming up now. Yeah, if you want to put it onto your slideshow, you're screen sharing really well now.
All right, excellent. So the topic of discussion for today is optimising preconception health. And as Tasha sort of alluded to, I look after couples all the way through, or women per se, preconceptionally all the way through their fertility journey, or going through cycles and trying to become pregnant, and then through pregnancy and childbirth as well. And as I've pointed out, preconception advice is often something that's quite lacking, but it's something that's exceptionally important in being able to prepare yourself for pregnancy.
I might just let you know, Joe, if you want to put it on your slideshow, so we're just seeing the screen as your normal PowerPoint, but if you want to chuck it on slideshow, we can see the whole.
It's got slideshow.
It doesn't really matter, to be honest, but we can see your slides as
Can you see that?
Yeah, we can see your slides, so that's fine.
All right, it's set up as slideshow here.
Sure.
As Tasha sort of alluded to, I am both an obstetrician, gynaecologist and fertility specialist based here at Epworth Freemasons, but also with Melbourne IVF, specialising in the areas of preconception advice, pre-pregnancy management and general obstetrics and gynaecology. One of the things that's quite evident as a fertility specialist is that most women, and in fact couples, get limited education when it comes to the general normal menstrual cycle. And for many women, it's difficult to know specifically, number one, when they're ovulating, and number two, when are the most key elements or times when conception can be achieved. The best way of thinking about a menstrual cycle is commencing on day one of your menstrual cycle, which is the day that a woman will bleed. And at that period of time, the hormones are actually at the lowest. So using this arrow, you can see here, this is when menses would occur, or when a period would occur. Having a look at the bottom, what you can see here is this is like looking at the lining of the womb. And the uterus is basically, if you imagine the uterus as being the surface of the MCG or the SCG if you're in Sydney, where if, for example, you are creating a nice plush grass at the very start of a menstrual cycle, obviously that grass will completely shed away. And then over the course of the menstrual cycle, the lining of the womb becomes nice and plush, hopefully waiting for an embryo to embed. Now, generally speaking, what happens is towards the middle of the menstrual cycle, when most women will experience either ovulation type pain or alternatively cervical discharge or some mucus discharge, this is the peak fertility window. For most women, that occurs around about day 14, which is 14 days preceding another menstrual cycle or another period, and 14 days after the previous period. If your periods are a little bit longer, then you need to adjust for when ovulation will occur. So one of the things about a menstrual cycle or your period is the constant period or the constant time between ovulation to the time that you bleed. That is always, generally speaking, around 14 days. So if you're having 35-day periods on average, then ovulation will be occurring at day 21 of your menstrual cycle. If you're indeed having 28-day menstrual cycles, then ovulation occurs at day 14. So it's important to know that if you're just subtracting 14 days from your normal length of your period will give you the time that's peak ovulation. And what I tend to say to couples is to have sex every second day, 4 or 5 days preceding ovulation to 4 or 5 days after ovulation, just to cover any variation that may occur. So again, for those women who are having cycles that are 14 days in length, having sexual intercourse sort of every second day from day 10 through to day 20 is best going to achieve pregnancy. That's what understanding your fertility window is. And of course, there's lots of apps. You can jump on my own app on my website, or alternatively just Google any sort of menstrual app to try to work out when your fertility window is. And of course, nowadays, with the advent of urine kits and also saliva kits in order to determine ovulation, it's a lot easier to be able to specifically time that as well. Some cases it takes the fun out of it. In some cases it provides a little bit more of a specific timeline. So those typical things that some women do is they look out for pain during their menstrual cycle. So something called Mittelschmerz, where the egg or the follicle ruptures open and that releases a small amount of fluid into the pelvis, which causes a bit of pain. Women will have an increase in their basal temperature, which should be taken first thing in the morning, and that will indicate that there's been a rise in progesterone, which indicates that ovulation has occurred. As I explained before, cervical mucus and the change in the cervical mucus to an egg white consistency will be, for want of a better word, indicative of high estrogen levels and therefore ovulation. And of course, there's urinary kit tests and saliva ferning patterns as well.
I should just mention, Joe, I noticed that when we're not scrolling through your slides, which slide are you up to? Because we're still on number 2 by the look of it.
I'm up to pre-existing medical conditions. So yeah.
We're not seeing your slides moving there, unfortunately. Oh, now it's moving? Okay. I'll let you take over. It seemed to just work then.
So where are you up to now?
I can see you now. So I shouldn't have told you. Otherwise, you're more than welcome to just talk and read through your slides. I just didn't want to have you stuck on.
No, that's right. Let's go back to it and see if I can share that slide again.
Yeah.
Can you see that now?
I can see that now, pre-existing medical conditions. We're just seeing it as a PowerPoint, as you would see the slides down the left-hand side and the screen not as a presentation.
Okay, that's interesting because I can see mine is set up as a PowerPoint, as a screen. Maybe it's the file that I've sent.
Sorry to interrupt you, Joe. The information's great. So, I mean, we can see it, so feel free to continue. I just thought I'd let you know what we're all seeing. Okay,
well, it depends if you'll be able to see the whole version. All right, we'll keep going and see what happens. All right. Yep. I'll continue to share and see what you see.
Yeah, I'll interrupt you if we get stuck on anything that doesn't seem right. So, yeah, feel free to keep going.
So part of any appointment that a couple might or a woman might have with me in terms of understanding or trying to get down at the bottom of either concerns with fertility or alternatively just as preconception is looking at pre-existing medical conditions. And so you're looking at things that might be identifiable and or reversible in terms of not being able to achieve pregnancy. So things like having irregular periods or painful periods. Irregular periods, of course, might point to something like polycystic ovarian syndrome, painful periods, endometriosis, and anything that may prevent an egg being released from the ovary and subsequently being transported down the fallopian tube. So previous surgery, removal of the tubes due to an ectopic pregnancy. And of course, for couples who unfortunately have had recurrent miscarriages, there may be either hormonal, chromosomal, alternatively clotting or autoimmune conditions that might be preventing pregnancy. And of course, males as well will have some impact in terms of overall the ability to achieve pregnancy. And it should be not understated that whilst this presentation is basically aimed at females, that blokes desperately and definitely need to maintain good health and exercise whilst they're considering a pregnancy, particularly as we know that guys produce sperm sort of now, the ejaculate of sperm is sort of is of their general health for the last 3 months. So making sure that you're maintaining good health patterns, certainly in the months leading up to conception and during that period of conception, is going to be vitally important in making sure that not only the quality of the sperm is good, but also that fertilization of the egg occurs. Now I'm going to switch to the next slide and hopefully you can see it. So can you see that one?
It's not moving, unfortunately, Joe. Hang on. Wait a sec. I'll let you, if you say something, it'll switch over to you. Yep, that's moved now.
Yeah, but it's moved as a result of me doing something. So just bear with me. I'm going to change it to a slideshow presentation and hopefully that'll fix the problem. If we take PowerPoint slideshow. I'm just going to spend a couple of seconds just quickly trying to work out if we can actually get you guys to see this as a presentation as opposed to something else. All right. Can you see me now?
I can see you now, yep.
Beautiful. All right, well, I'm just going to switch it to a presentation slide and hopefully it'll, I think it's the way that it's formatted. So with any luck.
We'll give it a shot.
All right, and I'll switch now to sharing it. If it comes up. It's not worked. All right, we're going to have to go back to as we were before, I think. Okay.
And even your information is great. So even if you either want to speak to camera or, yeah, if you want to.
That's all right. I'll have to click on each individual slide. So yep. I'll reshare it and then you guys can see it again. And I'll just keep it as this. You can see this now?
Yep, I can, yep.
All right, so I'll just do this because otherwise it's not going to work.
Yeah.
All right, so factors that generally speaking may influence fertility include obviously weight management. There's no doubt, and as part of my role within RANZCOG, the Royal Australian New Zealand College of Obstetricians and Gynaecologists, I'm the Deputy Chair of the Women's Health Committee. And one of our guidelines in terms of pre-pregnancy weight and management indicates that women really should be contemplating pregnancy once their BMI is below 35, and particularly the outcomes will be better indeed if their BMI is below 30. And part of that's maintaining good diet and also exercise. And all of this can be managed under the expert guidance of dietitians, of course, nutritionists, exercise physiologists, and overseen by a local medical practitioner, GP, or alternatively a fertility specialist or an obstetrician gynaecologist. I think it's important to realise why it's good to maintain a healthy weight range. And a lot of studies have shown that having a BMI in excess of 30 decreases not only the egg quality, but also the development of the follicles within the ovary. And of course, you need follicular development to release an egg. And therefore, as a result of that, there's decreased pregnancy rates. So often, some of the very simple advice that I give patients is not about putting them on medication, not about giving them injections or even offering them IVF. It's about simply reducing weight and maintaining a good, healthy diet. And particularly in this festive season, I like to say to couples, not to stress too much out about becoming pregnant, and that, hopefully in the new year, with not thinking about it, hopefully not eating too many Christmas puddings, the chances of pregnancy are great. And in fact, I never start anyone on any form of treatment during the late November to December period, because invariably a lot of them get pregnant over the early January period. And as I alluded to before, RANZCOG's guidelines with respect to any form of reproductive technology in terms of commencing a fertility treatment would suggest that the BMI should be below 35. So, why, again, are we concerned about weight? And it's not so much, I think one of the things that a lot of people focus on is becoming pregnant. And we know that miscarriages unfortunately can occur, but we also know that complications can occur throughout pregnancy. And as a fertility specialist who also looks after women during pregnancy, I'm very keen to ensure that not only do we have a pregnancy, number one, but also that we have a very healthy pregnancy and ultimately a healthy baby as well. So having issues in terms of increased weight can predispose a woman to diabetes during her pregnancy, high blood pressure, and the birth of a baby preterm, which obviously has impacts not only to the development of the child later on in life, but certainly to the stresses that the family might have throughout that journey. And babies can be too small and can be too big. And unfortunately for children or babies that are kept in utero or a pregnancy environment that's rich in sugar, they have a predisposition to later on in life developing diabetes and heart disease as well. And so what you can imagine is the type of environment that you create for your child inside the belly is ultimately going to be the type of environment that child will experience outside. And so maintaining a good, healthy eating and diet and exercise, as well as also the micro and macronutrients that are required prior to pregnancy, and will ultimately set up a pattern or a habit that will continue throughout pregnancy and be of great benefit to the developing fetus or the baby, and obviously to the child as it goes through childhood and early adulthood. And of course, we're not just worried about the 9 months of having a baby, but we're also concerned about the long-term impacts of health on children as they become adults. Now, I've done a lot of, much as Tasha has, a lot of media with respect to exercise in pregnancy. A couple of articles with Mamma Mia and also Essential Baby and the like, and it all boils down to this conception that exercise shouldn't be done during pregnancy. And indeed, the advice, and in fact, Jana Pittman was, almost hurdling. She wasn't hurdling, but she was certainly sprinting at 8 or 9 months of pregnancy. The simple fact is, if you're used to being able to run during pregnancy, then you should be able to continue to run. You just need to listen to your body, and you need to be able to also look for the subtle changes that occur during the early phases of pregnancy in terms of joint stability, and also change in the centre of gravity as you become more pregnant. So exercise before and during pregnancy, therefore, is going to be particularly important. And again, it's about establishing great habits preconceptionally that will allow you to transition into pregnancy and maintain that level of fitness. It's vitally important for pregnancy itself, but also for labour as well. And so we know that aerobic and strength training is exceptionally important. And it's an aim just to achieve shy of peak fitness. And of course, looking out for things that would potentially cause trauma or loss of balance, because of course, at this point in time, you're not wanting to do that sort of stuff, particularly as you're going towards becoming more pregnant. And, I'm reminded of the fact that I had one of my patients who worked for the circus, and she said to me, could she continue to do the tightrope when she was pregnant? And I sort of had to caution her about the fact that not only was her centre of gravity going to change, but also if she fell on her belly, of course, there were going to be potential problems. And I think preconceptionally, it's not about just maintaining good health and diet, but we also should think about the things that are going to occur throughout pregnancy, and that is the potential to develop urinary incontinence. So every woman, even before they have children, should be thinking about doing their pelvic floor exercises. And I think most of the urogynecologists out there and also the pelvic floor physiotherapists would recommend doing those at least 10 times a day, which for many of us, I don't think even boys should do them, but very few of us are able to achieve that. So it's important to consider doing that early on, before pregnancy, strengthen the pelvic floor, because as pregnancy continues, there's going to be obviously pressure coming from above that can be placed on the bladder and the supporting structures of the bladder. So again, exercising before and during pregnancy will do all those things that we talked about before. It will reduce gestational diabetes, it will reduce high blood pressure, and most importantly for those of you wanting and wishing desperately for a pregnancy, it'll improve fertility outcomes, and that's irrespective of whether you're trying to conceive naturally or alternatively needing some help. Of course, long term, it's going to prevent osteoporosis by maintaining very good bone health. And there's certainly evidence to suggest it will decrease the risk of cancer, both breast and also bowel cancer. And we all know, obviously, that exercise markedly reduces our risk of cardiovascular disease long term. So it's about maintaining a global health that's going to be good. Now, I always say to my couples, and I say to the women that I look after, I say it's not just about becoming pregnant. It's not just about having a baby, but it's also about being able to run around with the child when the child's 3, 4, 5, 6, 7, 8, 9, 10. You want to be fit, not only preconceptionally, but for the remainder of your life. So if the challenge, I suppose, is to become pregnant, and that's going to change habits in terms of exercise now, and they can have long-term effects, then you're going to have a hell of a lot of a much fruitful existence as a parent in the future. So what's the general advice that a fertility specialist, an obstetrician, a nutritionist, a dietitian will tell you? Well, one of the most important things, of course, is to commence folic acid. And we know that the folic acid has markedly reduced neural tube defects, such as spina bifida, through its use. And certainly our cereals here in Australia are fortified with folic acid. And we must admit that a lot of people may not be having cereals as much as they want for low carbohydrate diets, and so therefore taking a pregnancy vitamin that is enriched in folic acid is going to be vital. But of course, you may need additional supplementation of folic acid, and this is where it's particularly important to seek the advice of a doctor, because for those women who have propensity to either churn through folic acid at a higher rate, or alternatively where the requirements are a lot higher because the risk of neural tube defects are quite higher, then they'll need increasing amounts. So in diabetes, for example, in weight of an increased BMI of 30, these women should be on 2.5 milligrams. And so the most simple thing to do is cut half a tablet of Megafold by 2.5. Now, of course, for some women that's a bit difficult, and so you would just go on 5 milligrams. And I would take that over and above the general pregnancy vitamin that you're taking anyway. You can't overdose on folic acid. And of course, if there's a past history of a neural tube defect such as spina bifida, then these women should also be on 5 milligrams of folic acid as well. It's also worth considering preconception genetic carrier screening. There are a multitude of genetic carrier or chromosomal genes that potentially when there's one faulty gene married with another faulty gene in terms of a couple, that the child could have an illness that can be potentially prevented. And the three most common genetic disorders that we have in our community are that of cystic fibrosis, spinal muscular atrophy, and Fragile X. And so by screening for this beforehand, we're either able to advise couples to understand their potential risks of having a child born with some significant impairment, or in some cases special needs, or alternatively utilise modern medicine in order to prevent that from occurring. So I certainly encourage my patients to undertake a genetic carrier screen, although I don't think it's mandatory, and it's something that you should give due consideration to, but without feeling pressured into it at all. So that's one of the other things that's sort of from a preconception advice that's particularly important. So, obviously you've maintained a good diet, you've maintained good exercise, you're taking a pregnancy multivitamin that contains folic acid. If you're having concerns with the ability to become pregnant, do you seek advice? Well, ultimately it's when you as a couple or as a female feel that your ability to become pregnant is either you've got a concern with it, or alternatively, it has gone for a protracted period of time. And that may be for some women over the age of 35, 6 months, for women who are younger, 12 months. But of course, if you've got what are clearly identifiable reversible causes for infertility, such as not having sex as frequent as it possible because maybe there's a decrease of libido on both partners, if there's concerns with your partner's sperm, if there's been concerns in the past with respect to the uterus or the structure of the uterus, or if you have painful periods that might be suggestive of endometriosis. If in the past there's been a sexually transmitted infection and there's a chance that the tubes might be occluded or blocked. And of course, if you're not ovulating frequently, if you're not having a regular 28-day cycle, but they're coming 35, 40, 50 days apart, then these would be reasons to go and see your general practitioner and or seek the advice of a fertility specialist sooner rather than later to clearly identify that cause and potentially treat it. Now, for females, of course, just general advice with respect to the menstrual cycle. As we've already alluded to, ovulation kit tests or pelvic ultrasound scan may be all that's required just to see that everything's okay and that the chances of pregnancy are going to be high. I'd caution women on doing the ovarian reserve test or the ovarian clock timer test, because really outside of the practice of a fertility specialist, the AMH test or the ovarian timer test really doesn't have much clinical implications. A woman may have a very high AMH and still not be able to achieve pregnancy, whereas a woman with a very low AMH may equally so be able to achieve pregnancy quite easily. So it has to be monitored, and it has to be advised or interpreted by a fertility specialist. And of course, most fertility specialists will have access to an ultrasound scan and be able to provide additional advice as to what may be concerns in terms of not being able to achieve pregnancy. So I'm not going to harp on things too much, am I? But of course, lifestyle is going to be the greatest and the most, it's going to have the greatest impact on your ability as a couple to be able to become pregnant. So I think it takes two in order to make a baby. And it takes two in addition to that also to sort of inspire one another to greatness in terms of maintaining a healthy diet and exercise. So, certainly for women who are in a same-sex relationship, then obviously both parties should encourage one another to be able to maintain a healthy diet. For those women who are single and going through preconception advice and IVF in order to achieve a pregnancy, they still need to be supported by their friends and their family in order to achieve the goals that they desire prior to pregnancy. So healthy diet, healthy weight, we've talked about these before, but of course avoiding things that potentially can have an impact on pregnancy, such as cigarette smoking, alcohol and caffeine intake. And it's important to remember that, I remember when I was a medical student traveling around Europe and I was sitting in a cafe in France, there was a woman beside me who was pregnant at the time, and she was eating shellfish, she was smoking, she had coffee, she was eating soft cheese, she had everything that we would think absolutely you would never do in pregnancy, and of course she was pregnant. And I think to a certain degree we overthink things, and perhaps that's in part our own desires to achieve greatness, but at the same time it can obviously give us a level of stress that probably is not required. And certainly from the point of view of coffee, look, I'm sure all the European ladies would be screaming if we said to them they couldn't have a cup of coffee the first thing in the morning. So, there's no doubt that having one cup of coffee in the morning and up to about 200 milligrams of coffee over the day is absolutely fine, and you shouldn't stress out too much about that. It's important to maintain a little bit of exposure to sunlight, obviously being mindful of the risk of skin cancer. 15 minutes a day is ample, and that will provide the essential vitamin D required for the absorption of calcium, which is not only important for good bone health in an individual, but also in good bone health and development of the baby. So we know that maintaining a good health is going to improve our energy. When we do become pregnant, it's going to decrease the chances of morning sickness. As I've alluded to before, obviously decrease the risks of gestational diabetes or diabetes that occurs throughout pregnancy, and preeclampsia, which is hypertension or high blood pressure in pregnancy, but also improving birth outcomes. And not to overstate it, but improving birth outcomes in terms of a natural birth, decreases cesarean section rates, and they're particularly important for a lot of women. So we know, therefore, and there's been lots of evidence to suggest that having a very good health is going to improve hormones, improve the egg and sperm quality. It's going to lead to improved outcomes in terms of natural conception, and even if it's required, assisted reproductive technology such as IVF, pregnancy health as well. We've talked about how increased weight can influence follicular development and the quality of eggs, but it also impacts on the genetic development or the genes. It switches genes on and off, and those genes can, that's in the baby. And so those genes then can have an impact later on in life for the child. It also can cause disturbance in estrogen, too much estrogen, and therefore women don't ovulate, and a propensity to increase insulin levels and cause gestational diabetes or high sugars during pregnancy. And we've talked about IVF, but more specifically, when we do place an embryo back into the womb, there's less chance of pregnancy if a woman has an increased BMI. In terms of, what are the chances of things occurring to baby, we've touched on these before, but, having a small baby, having neurodevelopmental issues, these are all particularly important in respect to the development of the baby throughout the pregnancy. And of course, in the immediate period after pregnancy, there's an increased risk of infection, bleeding after pregnancy, a decreased uptake of breastfeeding, and also propensity to clots in the lungs and clots in the legs and depression. So what do we do then in order to maintain, well, we've talked about diet and exercise. Now we're talking about the optimal amount of nutrients throughout the day. Vitamin D, iron, folic acid, iodine, having good fats and a low GI carbohydrates are going to be particularly important in that preconception and during that pregnancy environment. So that's going to be vital in terms of maintaining good health. And I think we've missed one of the little bits here, but also choline as well, which is particularly important in the development of the brain development of the baby. And so most women will have an inadequate amount of choline, which normally comes from protein in our diet. And so again, having a supplement that's got additional choline in order to help with the brain development of the bub is going to be particularly important. So we touched on smoking, and we touched on its impacts in terms of pregnancy, but it does disrupt regular ovulation, and it causes an increased risk of miscarriage. And so therefore, we want to make sure that if we are smoking, and of course very few women now do, and certainly males, and it's quite a good thing, but if we are, that's one thing that we can control quite quickly and quite easily to improve outcomes. That's actually quite interesting how quickly we can reverse all the adverse effects of smoking in terms of not only conception health but also lung health by just stopping smoking. In a very rapid amount of time, lung function improves, and so do the chances of fertility. I'll try to bring this slide up because I don't want to get everything, but there's very simple things that we can do in order to prevent or help women in order to achieve pregnancy if indeed you've gone through the process of all that preconception workup, you've maintained a healthy diet, you've maintained good exercise, and unfortunately you've not been able to achieve pregnancy. And very simple things such as just cycle tracking may be all that's required in order to better time sexual intercourse and achieve a pregnancy. If a woman's not ovulating, we can give medication in order to stimulate the ovaries, either by using a tablet or alternatively using injections, in order to create a follicle that's mature on the ovary and facilitate ovulation and then subsequently intercourse in order to achieve pregnancy. And then there's other things such as intrauterine insemination, where I'd inject some sperm into the uterus, and this is particularly important for women who are utilising donor sperm, either a same-sex couple or alternatively a single female. And of course, if you've got any evidence of any gynecological concern, again, don't hesitate to see your local doctor. Don't hesitate to get referred on to a gynaecologist and fertility specialist to have a look and see if there's anything that's of a concern with respect to the uterus that can be potentially preventing you becoming pregnant. And of course, more and more women nowadays are thinking about freezing their eggs as we delay our fertility for later on in life, either due to work commitments or alternatively other commitments outside of that. Some women are choosing and electively choosing to freeze their eggs early on in their reproductive life at the age of sort of in the late 20s, early 30s, and have those eggs frozen for a later point in time where they can utilize those eggs if they need to in order to achieve pregnancy later on in life. And you know, there's a multitude of reasons for doing that. And if it's something that you would consider, then obviously seeing a fertility specialist with respect to that would be particularly important. We'll move through to just some general things with respect to, and this really isn't to talk about trying to achieve pregnancy, but you know, once couples have exhausted the opportunity of being able to achieve pregnancy through natural conception, then, you know, there are some things that we can do in order to facilitate that. And I've touched on those few. Ovulation tracking from the point of view of just simply following a cycle, whether it be through bloods or alternatively an ultrasound scan to determine when ovulation, number one, is going to occur and to better time sexual intercourse. We've talked about intrauterine insemination or artificial insemination and injection of sperm up into the uterus so that it's closer to where the egg is released. Of course, fertilization occurs within the tube, so making sure that the tube is open is going to be particularly important prior to this. That's a relatively simple procedure, very similar to a pap smear. And of course, really, and only when we've exhausted all options in terms of trying to achieve natural conception, cycle tracking, helping with ovulation, would we consider something such as in vitro fertilization or alternatively IVF. And last but not least, we talked about genetic screening prior to becoming pregnant, which I think is particularly important, especially in a select group of patients who might have a Jewish background, or alternatively just even in general Caucasians where the chance of having cystic fibrosis as a carrier is 1 in 25. It'd be wise to get screened beforehand. But there's also the opportunity to be able to utilize assisted reproductive technologies in order to prevent illnesses in children and also to prevent any chromosomal abnormalities that might occur that might prevent pregnancy, or alternatively, we'll change that to abnormalities, or alternatively cause miscarriages. And I'll be happy to talk about those more advanced things at a later point in time. But I think the salient things to take away from today are really three things. Number one, I think it's important that when you're commencing this whole journey towards pregnancy, that you really have a very strong mindset in terms of what are your ultimate goals. And of course, pregnancy is the ultimate goals, but thinking about, you know, maintaining good diet and exercise. And they're really the next two things. Really getting on track in terms of having a great diet, making sure that you're exercising regularly. And lastly, looking at the micro and macronutrients that you require preconceptionally in order to make sure that you've got those in store prior to conception. And certainly with folic acid, we'd be recommending you at least 1 month prior to pregnancy, and in some cases up to 3 months prior to pregnancy, so that it's not just becoming pregnant and then grabbing a pregnancy multivitamin, but moreover, thinking about that beforehand so that you're actually preparing yourself well for pregnancy. And last but not least, at any point in time in this whole journey, whenever you're concerned, that you would seek the advice of any specialist, and that may not necessarily be a doctor, but a nutritionist, dietitian, so on and so forth, to guide you through the process. And I think it's important also to realise that there is complements between both Eastern and Western medicine, and so we shouldn't shy away from some of the alternative type practices. But indeed, in terms of Western medicine, it's a well evidence-based and researched way of moving forward. So thanks very much for your time, and Tasha, I'll see if you've got any questions you want to ask of me.
Excellent. Oh, I think you've really summed it up really well there. And I think I love your main point to get across that, you know, we have some amazing technologies and we live in a world, you know, today where we have IVF available to us, but ultimately we are the ones carrying the genetic material. We are carrying the egg and the sperm that are going to create that baby. So how we treat our bodies and how we treat ourselves, we really should be treating ourselves as if we were pregnant before we even get there, because that's when all that genetic material is developing. And as Joe said, seeking the advice of your specialist, yeah, is super important. We have a lot of information. If you want any more information about any of the key nutrients or any of the points we've discussed, really, log on to the Conceive Baby website. We've got plenty of information there available freely, as well as seeing specialists like Joe who are on the directory. You can get information for people in your local area through our directory as well. And so thanks for everyone for putting up with us today. We apologise for the technical issues. As I said, we are much more passionate and better at helping you have healthy babies than we are at the technical side of things, but I hope you enjoyed the presentation today. We have lots more lined up for next year. I will be sending an email around about the specialists coming up for next year. They'll be commencing on the 7th of February. We're going to take a break over Christmas. So thanks for your time, and we'll speak to you soon. Bye.